Joining us now is Dr. Robert Murphy. He is a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Morning.
We have a story in the news this morning about variants of concern. What does that mean exactly?
Well, the virus continues to mutate. It's just a mutation machine, basically, as it destroys people. And it makes mistakes. And those are called, if the mistake doesn't disappear, in other words, if it doesn't stop the virus from replicating and stays in the population, it's called a variant. And if the variant has some kind of bad activity associated with it, such as easier to transmit or easier to kill a person, that's a variant of concern. And so 2 of these were identified in California recently. They've subsequently been named. So one of them is called B1427, the other one B1429. And so that's what's going on out there.
We talk about a baby being born for the first time with the COVID antibodies. What does that mean going forward?
Well, actually, this is good. This is what's supposed to happen. The mother, the maternal antibodies that she has are passed very freely to the baby. So the case that you're referring to, the woman, I believe, was a healthcare worker and got a vaccine at week 36 of the pregnancy. And had no complications or anything. And when the baby was born, the baby had antibody against the virus.
Wow.
That's supposed to happen.
And the AstraZeneca, we've been talking a lot about that. We keep looking at that to see if there's a problem with blood clots. Does it seem to be a big issue?
Well, Larry, that's the big question of the day. Are we overreacting or are we being extra cautious? What's going on? AstraZeneca, this vaccine developed at Oxford University in the UK, has already been given to 11 million people in the United Kingdom and many more millions of people worldwide. There's a big 32,000 person study ongoing here in the United States and Mexico that is not finished yet. So there's a lot of experience with this vaccine. When you do vaccine trials with the tens of thousands of people in the study, and then the vaccine is released to millions of people, you see a lot of stuff in the background. You see strokes, you see neurologic problems, you see other things, especially, with older people with underlying diseases, they're having all sorts of events. So is this due to the vaccine or not? And, it remains to be seen. We're not quite sure yet. I think this U.S. study is really going to be key.
All right, let's get to some viewer questions. I am not an anti-vaxxer, but I have concerns. No one is talking about the long-term effects of this shot. Why? Are we just hoping for the best 5 to 10 years down the road? Is there a list of all the ingredients in these shots somewhere?
So the second part of this question is very easy. The list of all the ingredients in the vaccine are listed online. It's very easy. You can Google it. The list comes up. It's very kind of not unusual ingredients. There's no preservatives, for example. And then, the big thing is the long-term effects. The vaccine itself, the particles, they're gone after a couple days. And so then all you're left with is the immunologic response. Vaccines are, people are very careful with developing vaccines, and typically people are followed for 1 year after a vaccine is put into use in these big studies. So those studies are, approximately 6 months or so ahead of the launch of the vaccine. So we have a sentinel group of people, tens of thousands of people that are being followed very closely, and they're not really seeing anything in that sentinel group. So long-term effect of the vaccine, typically, you don't see long-term effects. Mostly it's effect. I think we're okay.
All right. Next question. I am a teacher at an elementary school. Every adult in our building has received the second vaccination. The students are returning to the classroom. Can we teach without wearing our masks?
Well, it's difficult here because the kids can't get vaccinated. So, unfortunately, for the whole school community as a whole, masks should continue to be used. This is going to change, though. In schools, universities in particular, where everybody is older and eligible for the vaccine, when everybody is vaccinated, do you have to do all this stuff? And the answer is probably no.
Hey, I just have to tell you before you go, I was out last night, and someone came up to me and said, "Oh, do you work at WGN?" I said, "Yes." They're like, "Do you know Dr. Murphy?" I said, "Yes."
No.
Yeah, I'll give you his number. I'll give you his personal cell phone number. So I did. I hope that's okay.
Don't let it go to your head.
If you have
Me on the side there,
See? If you have a question for Dr. Murphy, you can head to our Morning News Facebook page and post it there. We'll talk to him again tomorrow.
Hey, we're doing new show opens with the head turns for the anchors. We got to add Murphy in there, right?
Yeah, get him in there.
Practice your turn.
I have to get in the lineup here.
Yeah.
Thanks, Doctor.